Well, thank you very much, John. I'm going to suggest that John and his colleagues are the people to approach if you want to find out more, or you can Google as we suggest. I found it really interesting, the whole issue of the frameworks, the politics, the power structures, and referred to the United States as Bill Gates. In our first session, we were talking about South Sudan. Whether you have a good example of chaos caused by political unrest and conflict, that is probably one of the best ones around at the moment. And the problems that are being experienced in Yei would be much ameliorated if they got themselves sorted out at a political level. So there is this sort of high-level stuff and low-level stuff. By low level, I mean out to one-to-one level. And our last speaker is Louise Hopley. Thank you for coming, Louise. Right. Louise is a physiotherapist from Poole, and you have, I think, we were given to you a handout which describes the Improving Global Health through Leadership Development programme that's run by the Leadership Academy in Health Education in England, in this part of the world. Louise was a fellow on this programme. She applied for a place, and Louise had a placement in South Africa for 6 months, and she's going to tell you a little bit about the work she was involved in.
Hi. So yeah, as John said, I'm Louise. I'm a physiotherapist in Poole, and I work in intermediate care. I'm going to briefly introduce you to Improving Global Health through Leadership Development Programme. So the programme is run through Thames Valley and Wessex Leadership Academy and is partly funded through THET. It's a unique opportunity as it allows really a real practical approach to developing leadership skills and also working towards the Millennium Health Goals. So all participants in the scheme will spend 6 months in a low resource healthcare setting around the world, and they're complete project work. And project work using quality improvement methods. And generally it's about, it's education focused and about system development and service improvement. So currently, you've got this information, but IGH have partnerships with Kisumu County Department of Health Kenya, which is a relatively new project, the Maddox Jodie Pitt Foundation in Cambodia, which is an NGO, and that's where it all started. And South Africa, the Western Cape, and I think quite recently the Eastern Cape as well. So participants in the scheme will be placed in any of these settings for 6 months, and that will be based on where their skills will be best met or needed. So just some examples of the type of projects you could do through IGH. So leading a whole community target hygiene and sanitation project, integrating key health messages into schooling, healthcare and other education opportunities. So that was Cambodia. South Africa, use of the S-Bar as a structured communication tool in the neonatology department in Groote Schuur Hospital. And the last one, improving community health services through the provision of educational resources for community health workers, and that was in Kenya. So you can just get an idea of the kind of breadth of the project that you could do. So some are almost field work, and others are based in hospitals, and some are very community based. So my project was in wheelchair services. So I was asked by the team, asked by IGH to go there, and the team asked me to look at wheelchair services. So I was to assess and improve the current wheelchair services in the district and support the continuing development of higher level seating. So I was in George, which is a very beautiful part of the world, so not a bad place to be for 6 months. And George is on the Garden Route in the Western Cape, so it's in a sort of district called Eden, and the Western Cape geographically is about the size of the UK. So a little bit of background. So wheelchair provision in South Africa is a legislative imperative. So there is a budget for wheelchairs, which is great. And the services are split into basic, intermediate and advanced as per the WHO classification system. So all hospitals in the Western Cape are pretty much set up to have a basic seating service, but intermediate seating Cape Town and George were the only two places. And in George, it had been running for approximately a year. But if you think of that large geographical area, it's a long way for people to have to travel. So what do I mean by types of seating? Because I didn't know before my placement, which is another great thing about IGH. You just learn so much because you're placed, you know, potentially out of your depth initially. You just react and learn all the time. So basic seating, a basic folding frame is for anyone that can get to 90 degrees hip and 90 degrees knee. Intermediate seating, and this was an example of the type of chair they would create in South Africa using lots of cheap resources. Anyone with mild to moderate deformity, all children are either intermediate or advanced, and it's about 58% of all users will go into intermediate seating. So I did a situational analysis using the WHO classification system of what should be included in a wheelchair service. And of that, one of the things I looked at was waiting times. Because it was easy to audit and I could use data that was already around, and it's something I could measure change in my project. And of course, clinically, time is really important in preventing any secondary problems, pressure sores, contractures, respiratory problems, social isolation, and the list goes on. And children who are obviously developing need to be positioned well and regularly. So as part of IGH, you're encouraged to use QI methods, and they teach you this before you go. And as part of your project work, you have to demonstrate that you're using these things. If you haven't got data, how do you know that you've changed anything? So just some examples: plan, do, study, act as a way of structuring intervention, staff interviews, observation, audit tools, and then analysing the data that you found, statistical analysis, lean management theory, which I found really useful. It's all things, you know, really outside of your day-to-day. You know, physio, patient, that's my concern, and I'm looking at systems and services and things. But it was, yeah. So, and lean management, you know, why, if it's not adding value, why is it there? It was a really simple way of looking at how services run. Process mapping, again, use this quite a lot to present to medical managers and to teams, to show how a service does look, or what the journey through the service looks like, and potentially how it could look. Cause and effect fishbone, use that to organise your information. So we knew there was delay, what were the causes of the delay, and then we could target our intervention based on that. So the main outcome of my project, so I looked at basic seating and intermediate seating. So basic stock, we reduced the waiting time from 2 months to 2 weeks. And that we looked at that and found that it was, you know, there was wheelchairs there. It was how the wheelchair was getting to the patient. So again, we used lean management theory, and we increased the capacity of primary care staff so they could run their own basic stock service. Intermediate seating was part of a much bigger programme. So because it had been running for a year, I kind of audited it through that year. And we found that people were waiting 4 months. So we put things in place but weren't able to measure it, unfortunately. But increased the storage space, spent a lot of time presenting to medical managers, and became an advocate for my wheelchairs. Looked at ordering systems again, stock control, formed a task team so that everyone in the district, and it was a huge area, I think the size of England is Eden, you know, all these physios working together and OTs. So we formed a task team to support the seating service. And looked at creative prescribing, so how to support the use of cheaper materials to get the desired outcome, and educational resources for that. So just personally, it really gives you experiences beyond potentially where you are at in your career, I'd say. So I was band 6 physio before I went. Used to have supervising students and maybe having band 5s and a little bit of service improvement, but you know, doing this, I was liaising with CEOs and presenting to district regional managers, and discussing rehab policy for the region with, I don't know, some incredible, you know, inspiring physios, but real advocates for their profession. So I'd say presenting skills, communication skills, self-confidence, audit tools. Realising my own potential to generate change, so having that space from not working clinically and measuring something, changing it, and seeing that it's done something was really powerful, very empowering, and really getting the idea of the bigger picture. So again, I think as clinicians, it's quite easy to be involved in your patient and want the best for your patient and maybe not see the wider health system. So when I got back, I was really excited for rehab, got a new job, and yeah. And yet it does all look a bit different, you know. I'm much more aware of how things are put together, feel much more empowered to change things, because I can do that now, or I probably could before, but I didn't realise it. Yeah, I'm taking on my own projects. Yeah, so I've got the websites there, and obviously you've got the information from John, but yeah, I would recommend it. Thank you.
Thank you very much.